Hi, I'm Jenny Lu. In this video, we're going to learn a few acupressure points that are good for relieving knee pains, then some simple exercises to strengthen the muscles around the knees, and also some alignment tips to help you stabilize the knees better during activities. Now, knee pains can be caused by many different reasons, so if you have seen a doctor for your current knee condition, make sure to check on the movements that are okay for you to do and know the ones that you need to avoid. Okay, let's get started. In this part of the video, we're going to go over 4 acupressure points that are great for relieving knee pains. So you can be seated on a chair, or if you're comfortable, you can be also on the mat. So we're going to do one knee at a time. You're going to pick one knee and just go use your index fingers. Go find right underneath your kneecap, your patella, find the soft spots, right? These are called the eyes of the knees. So you can find them and then just kind of bring your index fingers right there. And then your thumbs are going to land right above your kneecaps, about 2 thumb width apart, above your kneecaps right here. So you can put the thumbs here. And then the bottom, I can lift my leg up a little bit. So you can stretch the index finger, your middle fingers down. So on the outside, on the inside. So on the inside, right on the inside of the shin bone, your tibia, you can find actually a little tender spot. So this is your spleen 9. And then this point is good for relieving damp energy, any swelling. And the one on the inside right here, your thumb where it's pressing, it's spleen 10, which is blood C, or C of the blood. This is a great point also for knee pain. And on the outside, right above the kneecap, on the outside, 2 thumb width above the kneecap, that's stomach 34, is good for the knee pain. And then where your middle finger is stretching down, right in between your shin bone, right, your tibia and your fibula, right here, that's stomach 36. So it's a very powerful point on the stomach channel. It's called legs 3 mile or 足三里. So you have 4 points. You can just stretch your fingers out this way, gentle massage and sending healing energy to your knee. And you can just sweep. And then we're gonna go to the other side. So if you completely forgot which point to press, an easy way is to rub your palms. And you're just gonna land your hands right here as if you're giving your knee a really nice warm hug. And then you can rub this way, you can little gentle tap, sending healing vibrations. And then just really use your mind. Thank you, my healthy knee. Thank you, my healing knee. If there's pain, and just feel like you're sweeping away the pain from your knee. So both ways will work. Okay, really good job. You can come back up to a seated posture. So in order to make our knee stronger, we want to make the muscles surrounding the knee stronger. So in this case, for our knees, we want to get the thighs to be stronger and also the calves. So for the calf strengthening exercises, make sure to check out the video on this channel. I will link the video below for the 5 ankle strengthening exercises that'll help with our stability. So when you work on ankles, we definitely have to work on the calf muscle. And then in this video, we're going to go over for the thighs, for the quadricep part. We're going to do that right now. Okay, so taking your time. You're going to sit up tall. So however that's comfortable for you, you can bring your hands behind you on the floor, have your legs extended in front of you. And once you're here, kind of look at your feet. They're about like hip width apart, and then just let them kind of gently relax. And then you can see like once when you relax, your toes are kind of a little bit pointing to the side. So we want to actually engage the muscle. So you can look at your knees now. If you engage your leg muscle, trying to point the kneecaps and the toes up to the sky. And then you can even sit up tall if you want, or lean back a little bit is okay too. So you're going to contract the thigh muscle, the quadriceps. So when you do the thigh muscle, when you contract, you can see and feel the kneecaps being like lifted, right? So combing the thigh muscle up. You can try that a few times. So really squeezing, just really feeling the thigh muscles working. And we definitely use this one when we're in standing poses such as mountain pose or some of the balancing postures. It definitely makes a difference when you're combing the muscle or engaging your quadriceps right here, the front part of your thighs. And you feel the kneecaps, your patellas being lifted. Okay, so you can do that a few times. So again, seated is a great way to start, but once you get comfortable, you can do it while you're standing in class, or even standing in line, you can practice. Okay, and just kind of relax a little bit, and then now we can just wag the legs a little from the hip joints, massaging the hips. And from here, you can lightly tap. You can bounce the backside of the knees very, very softly. Also, we're getting an extra bonus acupressure point right behind the knee in the center of the crook of the knee. So this bladder 40, really good for local knee pain also. Okay, so light, soft bouncing. Great, so the next exercise that helps to strengthen the quadricep is leg lift. So several ways to do this one. So you can either prop yourself up here, or if you want, you can pick up the other leg that you're not working yet, and then the bottom leg that you are going to work, kneecap and the toes are pointing up to the sky. Relax the shoulders, sitting up tall. You're just gonna lift the leg up and then down. So do that a few times. See the leg muscle, you can feel the quads working. So you can do that like 5 to 10 times. And then switching sides, and I will give you options too. I know some of you can do a little bit more. So you can go this way. And of course, if this is not comfortable, you can be seated and just lift. And then feel your thigh muscle working. And know that your kneecaps, your knees are being supported. And then if you want to do both sides, and if you want to strengthen your core at the same time, drop the tailbone, engage your core, lift the legs up, so you can now do both sides, right? So staying here, you can breathe. And then when you're ready, you can slowly bring yourself back up, sitting up tall, putting the hands on the top of your knees, and just resting the hands. Center of the palms, you have the pericardium, meridian channel number 8, PC8, sending healing energy, gentle massaging motion. You can spread your fingers right over your knees, so palms over the kneecaps, your patellas, and then make soft fingers, claws around your knees, so soft tissues, and just kind of rub a little bit, sending healing energy. Roll the shoulders up and back. Good job. Now that we've learned a few different ways to care for the knees by relieving knee pains, making them stronger, we also need to learn a few different ways to help them to be more stable in our daily activities. So we can take an example from a stance we take often in class. So just this feet about shoulder width apart, and then we often make sure the center of the kneecaps are lined up with the second toe. So this way when we bend the knees go forward and back, they're hinge joints. They're aligned over where the toes are going. So it's better for this stability joint. Okay, so if you remember this one, and then when we take a wider stance, such as that of in the warrior one pose or bow and arrow stance in martial arts, same thing. The front knee is directly above the ankle. Your shin is perpendicular to the floor. Center of the kneecap is lined up with the second toe. And then from here, even for the back leg, because the back foot is slightly angled, right? The pelvis facing forward, and this back knee is slightly kind of angled a little bit. So this way, that knee is still aligned with the back foot, the back toes. Both knees are well supported. Okay, so just on the side note, you can see on this side, same thing. If you take the other leg, same thing, perpendicular knee over your ankle. There's no collapsing anywhere because you don't want the knees to be going laterally. So strong knee, strong thighs to support the knee, center the kneecap, line up with the second toe. Okay, so there you have it. So keep practicing these techniques and tools, and just know that most of the common knee pains happen with normal wear and tear, and that happens with habits that are not so healthy sometimes, and we're loading the knees incorrectly or using them not so mindfully. So keep practicing, and I hope you found this video helpful, and let me know what other topics you would like to see under this self-healing section of the channel. And then like, comment, share, subscribe, and also click the bell next to it so you get notified when I come out with a new video next time. I will see you in the next video.